Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now we have senile cataract. Right. In senile cataract, we have two types of senile cataract. That is, we have nuclear cataract and second we have cortical cataract. So first we have nuclear cataract, second we have cortical cataract. So first in the nuclear cataract. Right. In the nuclear cataract, actually, it occurs mainly because of increased age. Whenever there is increased age in the patient, this leads to nuclear sclerosis. And this nuclear sclerosis is mainly due to the insoluble proteins which are present in the nucleus of the cataract, resulting in nuclear cataract. And these insoluble proteins will also result in, along with insoluble proteins, there is also deposition of the melanin and urochrome pigments are present, thus resulting in nuclear cataract. Here, because there is deposition of the melanin pigments and urochrome pigments, the nuclear sclerosis or nuclear cataract which is seen is of different colors actually. So this nuclear cataract has one important thing which is called a second sight phenomenon is present in the nuclear cataract. So in nuclear cataract, there is cataract is present in the nucleus somewhere here, and there is a phenomenon called as second sight phenomenon, where here because of this nuclear phenomenon the patient will have the vision will be better, especially there is myopic shift will occur in the nuclear cataract. Due to this nuclear cataract, some people will have clear vision, some people will report that they have clear vision even without the glasses. So this is called as second sight phenomenon, and this is seen mainly in the nuclear sclerosis. And in nuclear sclerosis, vision will improve with pinhole also. In nuclear sclerosis, vision will improve in pinhole. Okay. Then we also have one more thing, which is nuclear sclerosis will only progress to formation of nuclear cataract. In nuclear cataract, the patient can have hemeropia or day blindness is reported. Along with that, the vision does not improve through the pinhole in nuclear cataract.
thank you and thank you for watching.